It's scary to be diagnosed with diabetes at a young age. But what's even more scary is to be diagnosed with diabetes when you're pregnant. And this condition is called gestational diabetes. In this video, I am going to be talking about what gestational diabetes is, the causes of it, the symptoms, when to see a doctor, and also the complications that is associated with this condition. And at the end of the video, I'm going to be talking about how to prevent yourself from coming down with gestational diabetes when you're pregnant. Hi guys, my name is Rachel from That Healthy Woman, and today I am going to be talking about gestational diabetes. Almost every woman out there wants to be pregnant. Almost every woman out there wants to carry their own child. But there are some conditions that can arise due to pregnancy, and today's topic is one of such conditions. Now let's begin this video by talking about what is gestational diabetes and why does it affect people in the first place. Gestational diabetes affects how your cells use sugar. Gestational diabetes is also only diagnosed when you're pregnant. It causes high blood pressure that can affect your pregnancy and the health of your unborn child. Although this condition sounds very scary, but there is good news. Gestational diabetes can be controlled. This you can control by eating good food, getting regular exercises, and if needed, you have to take medication. Because controlling your blood sugar level when you're pregnant can help keep you and your baby safe and healthy. Generally, if you are diagnosed with gestational diabetes while you're pregnant, after you put to bed, everything is supposed to return to normal. But if you have gestational diabetes, your risk of developing type 2 diabetes is higher the older you get. This means that you will need to get tested often for changes in your blood sugar level. Let's talk about the symptoms associated with gestational diabetes and what to look out for when you're pregnant. Most of the time, gestational diabetes does not give any sign. Most people just complain about constant urinating and always feeling thirsty. And these are the only signs that you might have. So you want to look out for that. Let's talk about the causes of this medical condition during pregnancy. Well, researchers haven't been able to come up with a reason why some women would develop gestational diabetes when they're pregnant and others will not. But there are certain risk factors that increases your chances of coming down with it. And one of such is being overweight even before you get pregnant. So if you are on the big side and you want to become pregnant or you become pregnant, your chances of developing gestational diabetes is much, much higher. Usually, different hormones work together to keep the blood sugar level in the body at a moderate level. Now, when you're pregnant, your hormones are everywhere. So it's not difficult for your hormone to maintain a moderate sugar level in the body. And this can increase your chances of coming down with gestational diabetes during pregnancy. Let's talk about the risk factors associated with this medical condition. So what are the things that can increase your chances of coming down with this condition when you're pregnant? Number one, like I mentioned, is when you're overweight. So if you are already on the big side before you got pregnant, then that increases your chances of coming down with that. Another risk factor is if you have an immediate family member who is diabetic, then you might also develop this condition when you're pregnant. Also, if formerly, like in a previous pregnancy, you had gestational diabetes, the chances of developing that condition in a second or third pregnancy is higher. Another possible risk factor for developing gestational diabetes is when you do not exercise at all, you're not active at all. You're just like that every day, you are just there. You don't exercise, no form of physical activity, then you might be at risk of gestational diabetes. Also, if you are pre-diabetic, you might also develop this condition. Another thing that increases your risk factor is if you formerly given birth to a baby that was above 9 pounds, or if you are from a certain ethnicity or race. So if you're Black, you are Hispanic, you are Asian American or American Indian, your chances of developing gestational diabetes when you're pregnant is higher. Now let's talk about when to see a doctor. If possible, you should get yourself tested early for gestational diabetes. Now, if you're a woman who is planning on getting pregnant anytime soon, you can go to speak to your healthcare provider, ask them to check your risk factor of coming down with gestational diabetes when you are pregnant. Now, this can be checked, and also to check your general well-being for being able to carry a baby to term. Now, once you're pregnant, your healthcare provider will check you for gestational diabetes as part of your prenatal care. If you are now diagnosed with gestational diabetes while you're pregnant, you may need more checkup more often. And these will most likely occur within the last 3 months of your pregnancy. Your healthcare provider will monitor your blood level and also the health of your baby. Next up, let's talk about the complications associated with this condition. Now, there are 2 ways that this can go. The complications can either affect you, the mother, or the baby. So I'm going to start with the complications that can affect you, the mother, when you have gestational diabetes. Gestational diabetes can cause high blood pressure and also a serious medical condition called preeclampsia. Preeclampsia is a serious medical condition that can increase your blood pressure and also affect and threaten the life of you and your unborn child. So gestational diabetes can increase your chances of coming down with preeclampsia. Also, if you have gestational diabetes, the chances of you giving birth to a C-section is much, much higher. Another complication that you might suffer when you have gestational diabetes is that it increases your chances of developing type 2 diabetes later in the future. And you might also develop this condition with subsequent pregnancies. Let's talk about the complications that affect the baby. If your blood sugar is higher than the normal range, it can cause your baby to become excessively big. Now, if you have a baby in your womb that is weighing above 9 pounds, the chances of the baby getting wedged in the birth canal is high. The baby might also suffer injuries while they are trying to bring the baby out. And also, that child will most likely be given birth to through a cesarean section. Another complication that can affect the baby is that you would have an early birth. Now, if your blood sugar level is high, it can increase your chance of going into labor before your due date. Sometimes, the doctors might even suggest that you have an early birth when the baby is too big. Another complication that a baby can suffer is what is called respiratory distress syndrome. A child that is born too early might develop breathing issues. Another complication that a child can suffer is hypoglycemia. So a baby who is born from a mother who suffers gestational diabetes can develop low blood sugar shortly after birth. And severe episodes of hypoglycemia can cause seizures in the baby. Another complication that a baby can have from gestational diabetes is being obese and developing type 2 diabetes later in life. So a child who is born from a mother who suffers from gestational diabetes might become obese later in the future and also is at risk of developing type 2 diabetes the older they get. Another complication that can arise from gestational diabetes that affects the child is that an untreated gestational diabetes can lead to stillbirth or even the death of a child shortly after delivery. So you want to get yourself checked when you're pregnant just to be certain that you do not have gestational diabetes. Now let me talk about prevention. So this sounds scary. This sounds like, oh my God, especially if you're pregnant right now or if you're planning to be pregnant anytime soon, this might be scary and you might be wondering, like, how can I help myself or how can I prevent this? I have a family history of diabetes. I have people in my family who are diabetic. How do I prevent myself from coming down with this condition? I'm going to get right into that right now. There are no guarantees when it comes to preventing gestational diabetes, but there are certain life changes that you can incorporate even before you get pregnant that can reduce your risk of being diagnosed with gestational diabetes. Also, if you've had gestational diabetes before from a previous pregnancy, These life changes I'm about to mention can help reduce your chances of getting it again. The first one is that you eat healthy food. Now, this goes without saying. If you want to live a healthy life, what you put in your mouth affects that. And this also plays a role when it comes to gestational diabetes. You want to pass off foods that are high in cholesterol, foods that are high in fat, for foods that are low in fats and calories. So you want to focus on eating fruits, more vegetables, more of fiber, foods that are high in fiber, because these are the kind of foods that help your body, repairs your body, and also prevents you getting big or developing cholesterol issues. I know this might be difficult to achieve, especially if you're the kind of person who likes to try different things. But even while eating healthy, you can still include different varieties without compromising nutrients or taste. I should also mention that you have to watch your portion control. You can't say you are eating healthy, but you're eating food for 4 people or 5 people in one sitting. So portion control also comes to play with regards to eating healthy. Another way you can reduce your chance of coming down with gestational diabetes is to exercise more often. You should exercise before and during pregnancy. You should aim for at least 30 minutes of moderate exercise. So you can either do like a brisk walk, you can ride your bicycle, you can go for a swim, you can roll up and down your staircase. If for whatever reason you cannot even go outdoor to exercise, you can still exercise indoor. So you can skip, you can watch videos that shows you how to do indoor exercises. You can even do something as simple as you are going to the grocery, you want to get some items, you park a few distance away from where the supermarket is, and then you walk that distance. All of this add up on the long run. So you want to make sure that you are always active, at least 30 minutes every day. So when you add all of that together, it's something, it prevents you from adding weight and developing this condition. Another way to prevent yourself from coming down with gestational diabetes is to ensure that you get pregnant at a healthy weight. So if you're already making plans to be pregnant, you have started talking about getting pregnant. If you are overweight currently, the first thing you want to do is to drop as much weight as you can, because it's easier, it's healthier when you get pregnant at a healthy weight. So when you start your weight loss journey and then you got into a certain weight that your doctor says, okay, this weight is good, it's fine, you can now get pregnant. Even while pregnant, you want to strive to maintain that weight. So you want to start eating healthy before you're pregnant and during pregnancy, as this would help you on the long run. My last point when it comes to preventing this condition is to prevent gaining excessive weight when you are pregnant. It's okay for you to add weight when you're pregnant. In fact, it's expected that you should add some weight when you're pregnant, but don't overshoot that. Don't overstretch yourself, because when you gain excess weight so quickly, it can increase your chances of developing gestational diabetes. So you want to watch yourself when you're pregnant. I know you can have cravings. You might be like, I'm pregnant, I want to eat anything I want to eat. That's okay. But always remember that the more you eat, especially when you're eating junks, the more you increase your risk of getting gestational diabetes. Now, if you've watched this video to this point and you've learned something, go ahead and hit that like button right there so that I know that you have enjoyed it, as this goes a long way to motivate me to create more videos. Also, share this video with your friends and family, because there's somebody on your contacts who needs to see it. If you're not subscribed to this channel, what are you waiting for? Go ahead and hit that subscribe button and join my family. You also want to turn on your post notification bell so that way YouTube personally notifies you every time I drop a similar video just like this. And lastly, let me know in the comment section if you have experienced gestational diabetes before, or you know someone who has suffered from this condition, and how you were able to defeat this condition. I'll be in the comment section reading to also learn more about this condition. And remember, your health is your wealth. And with that, I'll see you in my next video. Bye, guys.